Just to start off with, there is one additional new case of COVID-19 to report in a managed isolation facility today. So that's in addition to the 4 confirmed cases that we reported last evening in the Auckland community and that were announced yesterday. There are also an additional 4 probable cases who are people with symptoms linked to the 4 community-based cases we talked about last night and earlier this morning. All of these probable cases are awaiting test results. We will make available the test results as soon as we have them, but they are all being treated as probable cases and therefore are in full isolation, and full contact tracing has been initiated for those cases. The case that is in a managed isolation facility is a woman in her 50s who arrived in New Zealand on the 7th of August from Islamabad via Dubai. She has been in managed isolation since, and her positive test result was returned when she had a test at around day 3 of her stay. She is now in the Auckland quarantine facility. So our total number of confirmed cases is now 1,225. 5 of the previously reported cases have recovered, so the number of active cases remains at 22, none of whom require hospital level care. Yesterday, our labs processed 4,225 tests. That brings the total of number of tests completed to date over the 500,000 mark, and the total is 502,705. I'd just like to provide an update on the Rotorua situation, which I mentioned this morning. We now have a little more information I'd like to share, and we will have more information that we will make available on our website and through media updates as the day progresses. Based on the information we do have, we are confident that the visit to Rotorua of the 4 family members, 2 of whom have subsequently returned a positive test, has not resulted in anyone who is classified as a close contact. However, we are taking a very precautionary approach, as you know, and the family, in the time they were in Rotorua, which was between the 8th and 11th of August, visited a number of locations, including eateries. I don't have the specific information on those as yet, but as soon as we do, and have notified those businesses and have the time and dates that they were there, we will publicise that. What I can tell you is that we can confirm 3 locations. The first is that the family stayed at the Waiora Lakeside Hotel from the 8th to the 11th of August. And 2 of the visits they undertook were to the Skyline Gondola and Lodge, which was on the 9th of August from 4 till 6 p.m, and the Heritage Farm and 3D Art Gallery on the 10th of August between 3 and 4 p.m. So as we find out more detail about other locations that they visited, we will make that available, and we will also send out an alert via the NZ COVID Tracer app, so people who were at those locations at the time and on the date that we talked about and who scanned in with the app, which I hope people did, they will be made aware as well through that means. In the meantime, from a health perspective, we remain confident that alert level 2 is the right level for Rotorua, and the advice doesn't change. Anyone who was in those locations at that period should be aware of symptoms, whether they are from Rotorua or were visiting from out of town. Testing in our managed isolation and quarantine facilities is progressing alongside our community testing, and as the Prime Minister mentioned this morning, between Auckland and our facilities in Rotorua and in Christchurch and in Wellington, there are between 6,000 and 7,000 people to test, and testing was underway from this morning at all those sites. And we know that DHBs have a plan in place to ensure that all people who fall into that category are tested over coming days. Auckland is clearly the majority of those people and where we will be concentrating the effort. An update on contact tracing. As of around midday, just over 200 close contacts had been identified, and over 100 of those have already been phoned and spoken with. Most of those contacts are from 2 workplaces, and those people had been told last evening or this morning to remain at home. The workplaces are closed, and to stay at home until they were contacted and given further instructions. What I would like to do at this point in time, though, is just to back that up with an action that I can take under the Health Act. And because I think there is a serious and significant risk to the public with the spread of COVID-19 in communities in Auckland, as a National Medical Officer of Health, I'm taking the significant and serious step of making an oral direction under Section 70 of the Health Act 1956. So I require the following people to do two things, that is to isolate at their usual home and to not go out to work and remain isolated until they are contacted by our National Contact Tracing Service and they receive further direction. And that direction applies to the following people, if you could listen carefully. Any employees or contractors of two employers. One is Americold in the Mount Wellington suburb in Auckland, and the other is the company Finance Now, and that is the Dominion Road branch in Auckland. I would also say that the direction applies to the following, and that is any visitors to those workplaces in the last 14 days, and any people who ordinarily live with those employees or contractors or visitors.
Ministers will convene again tomorrow, and it was also agreed that a full Cabinet meeting will make decisions on Friday on next steps. Our aim will be to make sure that those decisions are in time to inform people of any changes well in advance of the Friday midnight setting we have for our Level 3 and Level 2 restrictions at present. At noon today, a new COVID-19 public health response order came into effect. The order provides the legal basis to require people to stay at home unless they are working in places where it is safe to do so, to ensure physical distancing and the conditions under which businesses can operate. Nothing in the order there in that regard is new relative to what we all experienced at Level 3 previously. They're all in keeping with those previous requirements, with just two exceptions. And I want to spend a bit of time just talking about those two exceptions that are new from what we experienced the last time we were in Level 3. So this is particularly important. First, the order makes it mandatory for any business or service to display a QR code for the COVID Tracer app prominently at all entry points, allowing everyone to sign in via the tracing app. So what is mandatory is the display of that QR code. We have allowed 1 week in order for business to be compliant. We understand that some businesses have not yet downloaded the QR code. We ask them to do that as soon as possible, but before it will be enforced, there's a week grace there to allow that to happen. Many businesses, as you'll note, have done that already because you'll see them on display. The ability to contact trace quickly is one of the key tools we have to find new cases and get them in isolation to avoid future lockdowns. So always using the app is a big investment in keeping our businesses and economy open. It will protect you and it will protect the people around you. Last night, over 100,000 people downloaded the app, and I would urge anyone who hasn't done so yet to get the app on their phone and get into the habit of signing into places. I can tell you from personal experience, it is very quick and it is very easy to use. The second new element of the health order is something I already briefly touched on this morning, and that is the requirement for people travelling out of Auckland to wear a face covering on a plane. We are specific to planes here because of the close proximity. Of course, we continue to ask people to only use this form of transport if they're leaving Auckland because it is not their primary place of residence and they need to relocate themselves. While we are not requiring everyone else in Auckland to wear a face mask or a face covering, we are strongly urging it. Think of it as a duty to one another and a simple act to help stop any spread. And it's now a proven line of defence for protecting your own health. It's also a sign you care about your community and the members of our team of 5 million. As I said this morning, the government has released 5 million extra face masks from the National Health stockpile. I can now confirm that 1 million masks have been allocated to Countdown, and we have another 1 million also available. The government has been in contact with social service agencies and other providers today, and it is also our intention to distribute 3 million masks via social services and delivery agencies to those who may otherwise struggle to afford or access masks. We're working with suppliers and supply chains to ensure that masks are getting to supermarkets and other places where people can purchase them. And of course, as I said before, cloth and reusable face coverings, bandanas, scarves wrapped around the nose and mouth, they will suffice. So if you can't get out to purchase one or the expense is a barrier, please use what else you may have on hand. So just to recap, the orders are as they stood previously, but now include the requirement around face masks for plane travel and the use of the QR code, that is the government QR code for the COVID Tracer app specifically, is included. I know I'm just about to finish, but I will wrap on this. I know many people have contacted Healthline because they have questions or because they might be feeling anxious. That is totally understandable. We have 600 people taking calls for our telehealth services. We've added another 90 staff today. By tomorrow, there will be another 180 staff working those phone lines. I understand, though, there are delays at the moment. I ask, if you've got questions about level 3 restrictions for Auckland, please jump online and just free up those services for those who might need them for health or mental health reasons. The COVID-19 leave support scheme, I do want to talk about this because of the anxiety that I know many businesses in Auckland in particular will be experiencing. The COVID-19 leave support scheme is there for all businesses that are experiencing financial hardship. It covers workers who are unable to work from home and need to self-isolate. The rate is $585.80 for full-time workers and $350 for part-time workers. Applications for the wage subsidy scheme extension also remain open until 1 September. That means if a business hasn't used the extension to date, but has experienced a 40% decline in their revenue, and that's across a 30-day period within the 40 days before they apply, they can apply and receive an additional 8 weeks of support. Now, I know the restrictions that are in place now in Auckland may tip people into now being eligible for the extension of the wage subsidy when they may not have been prior. It is still available. I encourage you to reach out to Work and Income, make an application if you need that extra support. The Small Business Cash Flow Scheme remains open until 31 December, and that gives interest-free loans for up to a year of up to $100,000 for businesses employing 50 or fewer workers. And of course, finally, the COVID income relief payment for people who lose their job between 1 March and October 30 as a result of COVID is paid at the same rate as the wage subsidy for 12 weeks, and that remains open until the 13th of November. Again, anyone interested in those payments, please reach out to Work and Income. Alongside this, the Finance Minister met with the Treasurer yesterday, and they're working on targeted economic support for the Auckland region if we're in a scenario where level 3 is to last longer than the present 3 days. A reminder too, this re-emergence is the exact reason why we set aside the remaining $14 billion of the COVID fund in case we had that need. Support aside, the best economic response remains that strong health response. Going hard, going early with a lockdown is still the best strategy for getting business back open as soon as it is safe. Before I end, a quick reminder of why it is just so important that we stick to the plan we're rolling out at present. There were 322 new cases of COVID-19 in Australia yesterday. 664 people are in hospitals, 54 in intensive care units and 39 on ventilators. Across the globe, there were 19.9 million cases yesterday. Our response to the virus so far has worked. It opened our economy and our communities, and it gave New Zealanders freedoms that we cherished, and we all want to get back there as soon as we can. But success relies us on all working together, looking out for one another. We know how to beat this, but we also know we don't need to look far to see what it can mean if we don't get on top of it. We have a plan, and now is the time to follow it.